Season 2 of Love, Transform, Evolve is brought to you by Dreams Financial. When I was looking for a new financial advisor, Alex and Steph were the obvious choice. They didn't just see me as a client, but rather as a partner in building and protecting my wealth. Their personalized approach and innovative solutions have made financial planning a breeze, not to mention the fact that they are in it with me, explaining everything as we go so that I always know where my money is going and why. And when it comes to the death of a loved one, Alex and Steph are experts at providing compassionate guidance, offering clarity and direction. For more information, visit their website at dreamsfinancial.ca. This is Love, Transform, Evolve. I'm your host, Cynthia Iorio, and this is Systems Managing Systems. Welcome to episode 4.
So many of us don't ask the next questions, right? We think the doctor is God.
What programs are available for her?
I need to figure out how to get help because it's such a challenge. When I started thinking about all of the systems that we interact with as caregivers, the list can go on and on. You've got hospital systems, transportation systems, weather systems. You're thinking about everything. And in order to manage all of the systems, you have to come up with your own system to do that. Caregiving is not this static, every single day looks the same way thing. It's constantly changing. And so every unique situation requires a different system to manage it. In my professional career, I am a project manager, and so I created and developed systems as the evolution for both of my mother and my father's illnesses progressed. I developed different systems that evolved and changed over time, but helped me provide some kind of a structure to the things that I'm doing. But when I think about systems as well, I also think about the medical system, and I think about the healthcare system and what is actually going on when we become caregivers. Oftentimes, we are thrown into this deep end of a huge system that is operating to its own beat. It has its own pulse. It's got its own network, if you would, and we're trying to figure out what our place is in this system itself. There are social systems at play. There are, like I was saying, healthcare and medical systems at play, and trying to figure out our space in these systems take the mental, physical, and emotional toll that we've been talking about in previous episodes. Claire Webster is the founder of the Dementia Education Program at McGill University. I first was introduced to Claire at the Teresa Delar Palliative Care Center's Education Day a few months ago, and Claire, as part of her speech, was reflecting on her own journey into caregiving and what her experience interacting with the different systems was like and how it made her who she is today.
So, I've been reflecting a lot on what brought me to do this work. And it's not just my mother's story. I have been a patient myself of the healthcare system as of the age of 16. I was misdiagnosed. I'm like the bionic woman, Cynthia. I have had 6 pacemaker surgeries throughout my life, many of them because of just being misdiagnosed. So it's not just the journey of my mother. I have had to be an advocate for myself as well. I was an only child, and I grew up in a home watching my mother be a caregiver to my father. I watched the experience of my father in the hospital and really the lack of compassion that was given to him while he was in the hospital. And so when I think that when I look back at that moment in 2011, when I had the burnout, and I'll be very honest with you, it happened again to me in 2020 after my 6th pacemaker surgery, because once again, I had another medical mishap. When a person has a burnout, it doesn't happen just overnight. I would look at it, it's a building up a multiple building up of traumatic events or things that happened that just hit ahead. And, I had spent a lot of time angry. And, I became a caregiver advocate, caregiver crusader, because, from the moment of her diagnosis or from the moment of my own diagnosis, I wasn't informed. Okay. I wasn't informed. And I think as a population, when you're receiving this type of diagnosis for whatever illness, so many of us don't ask the next questions, right? We think the doctor is God and he's going to tell us what we need to know, but we're so afraid in that moment to ask questions. And so I didn't ask questions about my own health. I didn't ask, when the doctor said to me, it's actually said to us, "Good luck, Mrs. Webster." I mean, that was it. When my mother was diagnosed, that was it. There was no, "Here are the next steps. Here's what you need to do." There was nothing, right? And so because of that lack of information, education, and sadly, we know that in our healthcare system, you only have 10 to 15 minutes with a doctor, right? I wasn't prepared for this journey. And what led to that, the years later of my unraveling was there was no one in the healthcare system, from the CLSCs to nobody, ever asked me how I was doing, assessing me and my needs and myself, right? So I want to be clear with people, like, if burnout doesn't just happen overnight. And, when I work with caregivers, you're not just dealing with the person that's ill, you're also dealing with multiple factors in your life, your career, your children, your husband's family. So it's just this big all come together and just explodes.
Right. And I think so one of the reasons that I think that you highlighted that contributes to people feeling this overwhelm is that they are not acknowledged, in this carer role, right? And I remember I talked about this in one of the episodes on season 1 was, when I was standing over my father's hospital bed, and it had been 3 very intense weeks of this very strong learning curve of this is what he has and how long do we have left, and let's, okay, where's his finances, and I was gonna, he's palliative, so you're in the thick of it. And the healthcare professional who's a palliative nurse turned to me and said, "And how are you doing?" And it caught me off guard. And this was 8 years after my mother passed away, and I had already that experience. And I looked at her and I said, and I immediately burst into tears. And I said, "You can't ask me that. It's not about me. It's about her." But she knew that she had to ask me. And the sooner into the process that the system acknowledges, the sooner we can maintain a sense of, I guess, identity, if you would, through the caring process, right? So what's, I think, unfortunate, or what I'm hearing, is it's all too often that we're not acknowledged. And so your voice, your advocacy to be there for yourself is just as important to be there for somebody else.
Especially, in the space of dementia, what I've come to learn in almost now the close to 20 years that I've been involved in this field is there's such a lack of education towards family caregivers, towards patients. There's a lack of public awareness about all the signs and symptoms of the disease. So most people, by the time they get a diagnosis, it's almost like the disease has already advanced to the stage. There's so much stigma. My team and I, McGill, we're fortunate to be the authors of the 2021 and 2022 World Alzheimer's Reports. And, part of the job that we had to do was do a survey of caregivers and patients living around the world and what were some of the biggest challenges that they face. And, with dementia, most of the time, the respondents are the caregivers, because the person who's living with the illness oftentimes is not as aware. But what is clear on a global scale is the lack of education that is not provided to people, right? And it's mind-boggling. It's a global problem. And imagine being diagnosed with heart issues or cancer or diabetes, and you're told, "Good luck. There's that. See you in 6 months." Like, it's mind-boggling.
Listening to Claire and what she had to say in her reflections brings me back to the moment of hearing the diagnosis for my mom and also for my dad, and thinking about myself in this perpetual state of fear and feeling this overbearing, daunting burden on top of me to figure out what it is that was about to be expected of me. And as Claire said, we hold the healthcare and the medical system to a certain standard, or on high, if you would. And in my case, I felt insecure and unequipped and vulnerable, almost a David versus Goliath, if you would. I'm a tiny little pawn in this really, really big system. How the heck am I going to have a voice? How the heck am I going to advocate? How the heck am I going to help these people in my life who need the help? So when I feel this way, especially on the other side of it all, and I think back about systems, I get curious and I start asking questions. And I wanted to know about the healthcare system itself, like what's actually going on in the system. I alluded in season 1 to the fact that medical professionals, they themselves, I believe a lot of them are victims of the system just as much as we are. The system has failed us, so many of us. But I'm just curious, like, what is this system? What's actually happening? And I reached out to somebody named Mark Stolow, and he's the CEO of People Before Patients, which is an organization that aims to inspire the developmental leap from healthcare to human care. Mark's been in this space since 2004, and he works with professionals in the healthcare field and who interact with the healthcare field to help make sense and improve the experience for both those in the field and those outside of it. I asked Mark, how does the healthcare system work, and does he see the same challenges that I see? And it was really interesting to hear what he had to say. So you've been working in the healthcare space for over 20 years, and you probably understand the issues better than most. What would you say are the key challenges facing us today, and what sort of changes are needed?
I mean, I should clarify that, the understanding of the system is a work in progress, like the system itself. I think at some very fundamental level, we aren't yet quite clear what we mean by health and care. And so we perform this thing called healthcare, and we aren't often allotted the time or the space to more deeply reflect on what that means.
Sorry, when you say we, can you tell me who we is?
I'm kind of talking about the proverbial we, but it could be anyone from people impacted by a health issue, people in practice, people leading health organizations, policymakers, this ecosystem we call healthcare. What I've noticed in the last many years is that while we hope that it's an ecosystem, it actually doesn't move or operate the way ecosystems actually work. Like if you go into a forest or you experience a meadow, as Nora Bateson might say, you can't help but notice, one, that just being in that system, you're part of that system. And that two, that there's this very deep interrelationship between all things. It's very hard to understand, the tree without understanding the forest, because the forest is foresting. Everything is in this deep interbeing, interrelationship. One thing moves, all things move. And what we've done in healthcare in a kind of post-industrialized world is we've tried to turn healthcare into this thing where there's a collection of parts, sometimes called silos. You hear this a lot, silos. The parts don't speak particularly well to each other. They're not particularly in great relationship with each other. There's a kind of constant friction and conflict. And then, of course, people who then move into those systems as parts get the very distinct feeling of that friction. That's not working. This isn't working. That person said this. It didn't do that. I mean, the list goes on. And everyone you talk to in healthcare describes this kind of betrayal, the sense that they notice they're suffering. They think they're moving into this thing called a system that was designed to alleviate the suffering. And yet what they noticeably experience, among sometimes alleviation of suffering, is also this conflict and this tension. Because the system in its factory form isn't well designed for this deeper sense of interconnection, interrelationship, interweaving of things, which when you start to examine health more specifically, which really means being whole, and then you look at care more carefully, which really means being in relation, we could say the more ecological form of healthcare would be something that is wholly in relation. And yet healthcare looks nothing like that.
I mean, I think that's such an incredible analogy. And when you were talking, the one thing that really resonated to me is that the caregiver who is outside of the health system, if you would, the traditional health system, the ecosystem, they themselves become implicated and almost becomes a node that has to reach out and interact with these independent silos, which creates an element of confusion and complexity and frustration, because they walk in, I know I can speak for myself to say that I walked in assuming there was a system, an ecosystem, and
Right.
soon realized that I had to be the bridge and the gap between the broken system that was.
Yeah. Yeah, it's a very common experience that caregivers who are going through this what feels like a fracturing experience, something has changed, something feels broken, something feels unfamiliar, go into the systems and somehow feel a sense of that experience as being mirrored. And then, to your point, many feel like they have to be the glue that's holding this ecology together. But there's no glue in a forest. There's not one thing holding it together. It's holding itself together. The forest is foresting.
So after Mark was talking about the healthcare system being like a forest, right? And the forest doesn't think about being a forest, it's just a forest. He went on to say how crazy it is that we need to have caregiver advocates. Like the healthcare system needs to be a healthcare system that all individual people thrive within, including caregivers, but we're all in silos. And so we have to be this glue for all the individual groups in the healthcare system, and it just doesn't make logical sense. But it is the reality that we are living in right now. And so what do we do? What do we do in this situation when there is this betrayal? We have conversations with each other and we talk about it and we normalize it, and we have to lean on one another to have solidarity, but also to get insights in the type of help that's out there. Because unfortunately, there is not easy access to help and information just yet. You know, we need to raise our voices along with organizations like the Canadian Centre for Caregiving Excellence. We need to influence policy, and we need to do all of that to bring it into the lexicon, if you would, to bring it into our language, to bring it into our everyday lives. That's what we need to do. And we need to stand in our power. But also we just need to share what's out there with one another. I asked Brian Sutherland, who's a product manager that you heard from in episode 1. Remember, he was a caregiver for both of his parents. What was his experience like, and where did he seek getting help from, for example, governmental organizations? Here's what Brian had to say. I'm going to talk about the money a bit, because you're in the U.S. and Pennsylvania. You know, the way the government supports people is different in the States than it is. So are there government tax credits for caregivers where you're located? Are there programs? Are there barriers to entry, to access? Having been a caregiver for so long, what have you learned in that space?
So, interestingly, yes, there is. The thing of it was, and I didn't get a chance to really investigate a lot into it. So at the time when I first started the journey, I mentioned earlier, I didn't really know. I didn't even call myself a caregiver at that time. So at that point, I didn't really feel like there was any tools at my disposal, and looking into what I can. Now, a lot of the tools at that point, because it was mostly financial security that we were talking about, was really more of what tools my mother had available to her. And so her tapping into the state and trying to understand, well, like what programs are available for her. So, she had a lot of medical complications, tapping into like the requirements for Medicaid specifically, and how she was able to leverage that for getting her healthcare needs. So, based on those programs, I was starting to investigate into toward the end of her life, not knowing that it was the end of her life. Her passing actually did happen fairly suddenly, although we had some clues, but it happened at a point where we thought she was on the mend. But we were looking into things of what were the programs that were available. Like, if I remember correctly, you could actually get stipends to become a full-time caregiver, and that's in place of your full-time job. But unfortunately, I didn't get a chance to really investigate too heavy into how could I do that. And between me and so my siblings, who both live pretty far apart, we were looking into ways of financially supporting our mother toward the end of her life. We were trying to make her as comfortable as possible while continuing to maintain those very necessary boundaries.
Where did you start? Like, for somebody right now who's maybe in the position that you were in, who is sitting there thinking, I need to figure out how to get help because it's such a challenge. Like, where did you start, or what guidance would you give somebody?
Yeah. So, I mean, I'm very blessed working for a company that has, an employee assistance program. I started there, honestly, when I was getting toward that last part. And quite frankly, just asking the questions like, what are resources that are available to me that I could leverage? And some of the output that I was getting, my mother required some nursing needs at certain points. And so they were able to connect me with, provide me a list of, hey, here are a list of facilities that do in-home nursing that you're able to hire, bring them into your home, have them provide any additional level of care. And, in her case, it was right-sizing the level of care, not just like saying, hey, we're going to have somebody come in here and then kind of sit around and do nothing all day, right? Like, make sure it was for like the right reasons. So that's at least for me where I started.
That's great. And it sounds to me like they became like thought leaders, partners in this ultimate journey that they could help guide you.
Exactly.
Listen, we can't do caregiving alone. We're not in a vacuum. It's not happening alone. As you heard from Mark, as you heard from Claire, there is so much at play in the caregiving role. And more, there are resources that are becoming available. And the moment we can step into this role and realize that we are doing caregiving and we are caregivers, the moment we allow ourselves to open ourselves up to ask for help. And there are a lot of resources that are available. I listed some out in season 1. There are other resources available in the States and in Canada, like the AARP. There's caregiving.org. There is the Ontario Caregiving Organization. There is L'Appui Québec for those who are in Quebec. And in these show notes, I'm also going to drop other resources that are available as well. Please come back and take a look. You are not alone. There is a lot out there. This is a developing space and it's becoming more and more prevalent. How do you feel about where you fit in the system, and what are things that you've done to help navigate the challenges brought on by the disconnectedness? If you like what you heard today, be sure to rate, follow, or subscribe wherever you get your podcasts. New episodes from Season 2 of Love, Transform, Evolve drop every Wednesday morning. I'm Cynthia Iorio. Until next time.